Hi everyone, Dr Paul Schiavo here from Ortho Regen. Hope you're all well. I just wanted to take some time and post a video on platelet-rich plasma, or as it's more commonly called, PRP therapy. There's definitely been an explosion of clinics and physicians offering this treatment in Australia. And unfortunately, we've started to see a run of patients through Ortho Regen that have had PRP therapy at other clinics provided by other doctors. And they haven't had the desired outcome or effect from that treatment. So I wanted to provide some information on PRP, but also give you some ideas on questions you can ask the clinics or physicians that are offering this treatment, so you can make an informed decision as to whether this therapy is right for you. So platelet-rich plasma, for those of you who don't know, it's where we take a small amount of blood from the patient and we process that blood and we inject that concentrated platelet blood back into areas of disease such as joints, ligaments, tendons, muscles, nerves, and discs. What's commonly not known in the community is that there are various different types of PRP. PRP is definitely not all the same. And that is, I think, one very, very important point when you've been recommended this therapy, to ask the clinic or physician what kind of PRP they're using, what process they're using, what machine they're using to make the PRP. So there's two main types of PRP. One is red or leukocyte-rich PRP, and this contains concentrated platelets and white blood cells, in particular monocytes. And research has shown that leukocyte-rich PRP tends to be better for tendinopathies or tendon injuries. The other type is amber or leukocyte-poor PRP, and this just contains concentrated platelets with very limited or no red blood cells and white blood cells. And the research has shown that this type of preparation is better for joint disease such as osteoarthritis. There are other variations regarding the cellular therapy PRP, and one of them that we use quite a lot in our clinic is a platelet lysate and autologous conditioned serum. And this is still a blood product from the patient, but instead of injecting cells, we break those cells open and we concentrate up the numerous healing growth factors that are contained in those cells. And then we inject those growth factors into areas that are diseased or areas that are causing pain. We find it very good for muscle injuries and for nerve pain or nerve injuries. So we use it a lot in lower back pain with epidurals and nerve root injections. So as you can see, all PRP is not the same. There are definitely differences in the concentration of the cells, the preparation of the cells, whether PRP is used in conjunction with other therapies. And I think that's important to note that when you see clinics offering this treatment, that you know that all PRP is not made or basically used the same way in those clinics. So definitely some of the questions that arise from the PRP preparations not being all the same is how much experience the clinic or physician has had in treating musculoskeletal injuries. Definitely this field of regenerative medicine and interventional orthopedics, it's starting to become its own specialty. We take a very different approach to the diagnosis and management of pain and orthopedic injuries and conditions. One of the big differences is that whilst we use scans, images such as MRI, ultrasound to help us diagnose a condition or where the pain is coming from, we don't assume that just because the scan shows something that is the problem. So we have a saying that, instead of treating the scan, you treat the patient. So we tend to take, detailed histories, thorough comprehensive examinations, and then use images or radiological investigations to help us understand and get to the root cause of the condition. So I think that's one of the big differences with the interventional orthopedic specialty compared to kind of traditional medical models, is that the scan doesn't always show what's going on. So you definitely need to know the experience that the clinical physician has in kind of diagnosing and managing musculoskeletal injuries. On the same line there, I think it's important to know how much experience the physician has had with using platelet-rich plasma. As I've said, there are different types. Different types have different outcomes for different conditions. So you need to know which preparation is the best to use for what condition. The other important aspect of treatment with PRP is how much experience the physician has in ultrasound. Number one, to try to make a diagnosis, and number two, to aid in the injection of PRP. The precise injection of PRP therapy has revolutionised the outcomes in patients, and the blind injections just don't seem to have the same outcomes. So you definitely want to know the training, the experience that the physician has had in ultrasound or X-ray guidance for those injections. Going back to the different types of PRP, you want to know what PRP the physician is going to use. Is it going to be leukocyte-rich, leukocyte-poor, platelet lysate? Is there going to be a combination of treatments such as PRP with hyaluronic acid or adipose-derived fat stem cells with PRP? So that is an important question. Along those lines, you definitely want to know if the physician will be using a cell counter to confirm the concentration of the platelets in that preparation. There are a lot of clinics that are not doing that, so they are using a number of commercially available centrifuges and calling it PRP and not knowing what they inject, and the patient's not knowing what they're getting. So we know in research that the concentration should be around 5 to 7 times compared to whole blood, and this concentration has been shown to be quite good for healing tissue. So that's very important that you as a patient, I think you want to know what you're kind of getting and what's kind of being injected, and you want to know that the physician that's providing that knows that as well. So you kind of want to know how many treatments you're going to need as well. Look, in our experience, about 90% of patients, probably over 90% of patients have only need one treatment. I have heard of radiology clinics and sports physicians using, I guess, cheaper PRP machines and providing, I think, a suboptimal PRP therapy and getting the patient to come back every 2 weeks for, say, four injections. Definitely the research and using a appropriate and high-end protocol to make PRP preparations don't need multiple injections. So I think that's an important question, so you know what's involved with the treatment plan. One of the big things that we find stimulate healing and help in treating the condition is having an exercise or rehabilitation program after the PRP therapy. So I think that's an important question as well, that you ask the physician, what's the kind of rehab after the injection? We think it's extremely important. Research shows the benefit of exercise, strengthening and conditioning. It needs to be done, otherwise, unfortunately, the suboptimal outcomes are going to be there. You want to know kind of how long it's going to take, after the injection. How long is it going to be before you see improvement, before you see, changes, before you can kind of get back into your normal activities? And so you want a physician who's had experience in that, knows, if the improvement is slow, how to kind of stimulate some more healing. And so, I think that's an important question as well. So, look, I think that there's a hell of a lot of information out there. I just feel that there's a bit of misinformation regarding PRP and that it's all the same. And so I wanted to provide this information to you today, and I hope that it's helped. We're always here at Ortho Regen, so if you've got any questions or want further information, you've been recommended PRP or other regenerative medicine treatments, and you want some information on that, please contact us. We're here to help. And in the next few days, I'll post another video and blog on a patient that really confirms the difference in regards to a clinic or provider that just does a standard PRP, non-precise injection, cheap system, and compared to how we treated this patient and her outcomes. So I hope that's helped, and I hope you have a good day, and we'll talk to you again soon. Thanks. Bye.